This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today I'm going to talk about how to tell if you tore your rotator cuff. If you like this video, we put out new content weekly, so please like and subscribe, and note that I can't give you any specific medical advice about your specific condition. So how to tell if you tore your rotator cuff. If you have an acute tear of your rotator cuff, meaning that you didn't have a tear before and you did something and you may have torn it, usually what will happen is you're going to have a lot of trouble lifting up your arm and it's going to hurt pretty bad. In those that have torn the rotator cuff, that's generally how they present. Now there's a whole host of other rotator cuff tears. Some people have sort of these partial tears where it doesn't tear all the way through, and they've got a few of those, and sometimes those don't hurt, sometimes they do hurt. Or sometimes if people are older, they may have had tears for a long time. At that point, the cuff, instead of attaching to the shoulder like this, it all gets cut and moves back like that. But really the easiest way to, if you did something to your shoulder and you can't lift it and it hurts really bad, you may have torn your rotator cuff. Now there's a lot of other stuff that goes on into the shoulder. It's a fairly complicated joint. So it's possible you don't have a rotator cuff tear and you have shoulder bursitis or impingement. When someone has that, it can often present like a rotator cuff tear, and that's something that usually doesn't need surgery. It can just go away with some exercises and sometimes a steroid injection. Even sometimes with rotator cuff tears, if they're partial thickness tears or they're not full thickness tears, sometimes the first line of treatment is usually physical therapy and sometimes an injection to kind of get everything calmed down. And there's a lot of people that live with painless shoulders who have partial thickness tears. But again, if you have this acute tear where you just tore it and it ripped off, then that's usually, can't lift your shoulder in pain. But it can be tricky to tell. It's not one of those things where like you break your finger and your finger's all bent and you're like, okay, I know I broke it. It can be a little bit harder to tell. The definitive way to tell if you have a torn rotator cuff is to get an MRI, which you probably already knew. X-rays will not show anything. A good ultrasonographer can tell you if you have a torn rotator cuff on an ultrasound. But again, if you're getting an MRI, you're going to see your physician and they would evaluate you. I would urge you to probably see an orthopedic doc or or a family medicine, sports medicine doc who deals regularly with these sort of injuries. Your primary care doc, like I said, the shoulder is a complicated joint. It's very possible they might misdiagnose you. But anyways, I hope that was helpful about how to tell if you have a rotator cuff tear. If you have any questions I didn't answer, feel free to leave them in the comments below and I'll do my best to respond, but note that I can't give you specific medical advice about your condition. If you like this video, we put out new content weekly, so please like and subscribe, and thanks for watching.